Which procedure should be done, CO2 or neck lift? I am planning the two procedures based on all my consults and needs. If I don't have to do the neck lift, I would be happy. I know my results for each are different, but some tightening will occur from CO2. Not a facelift, of course. I have never liked my skin texture, some old acne scars, now some fine lines. CO2 would help. Should my neck chest be done also or just the neck lift? Which is best as a first procedure?
Thank you for your question. You've submitted a photo and you've described some of your thoughts as to making this decision on whether or not to have a neck lift versus a CO2 laser to address the appearance of your neck. And you also state that you, of course, would not want a facelift. So certainly, I understand why there may be some conflicting ideas between neck lift versus CO2 laser, but I think should be able to help clear that up for you. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon, practicing in Manhattan and Long Island for over 20 years. I've been using the CO2 laser for that long, and have a lot of experience with all kinds of lasers, and I perform face and neck lifts a lot in my practice. So when I have consultations with people like yourself, I always try to make a clear distinction, because I think a lot of the confusion comes from the very aggressive marketing of lasers. So let's understand something. Face and neck lift, whether it's facelift alone, face and neck lift in combination, or isolated neck lift. What are we doing? We're dealing with redundancy and malposition. That means that as we get older, the soft tissue sags. So what we want to do is define that. Define that as redundancy. Now that also means that there are other things. There's the muscle or the tissue underneath the skin called the SMAS, referred to as the superficial muscular aponeurotic system, and in the neck we refer to it as the platysma. This muscle also sags. It separates. It weakens. So with the photo that you submitted, I would say that it's reasonable to conclude that the jawline loss of definition and the sagging in the neck partially is contributed by the sagging in the face. And a simple way to determine that is to go to the mirror and do a mirror lift. Lift your face ever so gently and see what happens to your neck. I think you'll see that your jawline will improve. So understanding that a neck lift or face and neck lift is about redundancy and structure. So what do lasers do? Lasers improve quality, skin texture, and defined by fine lines and wrinkles and discolorations. There was a time, particularly in the mid-90s, where people believed, especially doctors who didn't do facelifts, would say would advise their patients not to have a facelift, but rather make their skin smoother with aggressive lasering. And patients believed that they could actually avoid a facelift by tightening up their skin so dramatically. Of course, that doesn't work, because you can only heat up the skin so much. We're seeing the same thing with a new coat of paint on it with the thermal devices, where it's not ablative like a laser, but they're heating up the skin, imagining that they can tighten the skin as effectively as a facelift. Can't do that. You think texture and quality. So in our practice, we will often combine both. We'll do the surgery, the lift, and the laser. Of course, we make adjustments on the laser based on the type of lift we do. But you can get both the issues addressed, but you have to understand one does not displace the other. So you have to think to yourself, if the texture and quality is more bothersome and you don't mind sagging, then you might be okay with doing just the laser alone. But my gut feeling is that, like many people who go for these treatments where they think they can avoid a neck lift or a facelift, you will be disappointed if you don't get the dramatic tightening that is naturally expected when you go through the trouble of having the laser and then the trouble of dealing with the aftercare. So I think you should meet with some doctors, meet with some cosmetic surgeons. Surgeons do both. They do both surgery and lasers, as opposed to non-surgeons who do mostly non-surgical things and will maybe dissuade you based on their limited scope of practice. So understanding that and getting opinions, you'll become more educated. When you push your skin like this and you get a real improvement, you can't get that with a laser alone. With that being said, I hope that was helpful. I wish you the best of luck. Thank you for your question.